How's it going, guys? We have a past level question for pulmonary. 41-year-old man with no vignette because we want you to know the radiology here. What's most likely seen in this patient? Choice A, CFTR mutations for cystic fibrosis. Correct answer. Diagnosis is bronchiectasis, very buzzy CT scan here. Ectasis, ectasia means dilation. Bronchiectasis means dilation of the bronchi with extension to the bronchioles. These large circles are our ectatic, our dilated airways. Okay, so very buzzy image here. The three highest yield causes of bronchiectasis in USMLE: cystic fibrosis, tuberculosis, heavy smoking history. 6 out of 7 questions, it's going to present bronchiectasis as cups and cups of foul-smelling sputum, copious foul-smelling sputum. Foul-smelling means anaerobes, such as Bacteroides. 1 out of 7 questions will be a pediatric case called right middle lobe syndrome, which they'll say scanty white sputum with a linear opacity in the right middle lobe. It's obscure, I know, but I'm just letting you know it exists. So we can also eliminate the other answer choices here. This is bronchiectasis. So they also want you to know bronchiectasis can cause clubbing, by the way, as per my observation across the MBME exams. Choice B, deficiency of antiprotease is wrong. So of course this would be alpha-1 antitrypsin deficiency. And you could say, well, COPD could lead to bronchiectasis. It could, but it's not the most common cause. I've never seen this association on NBME either. If they want alpha-1 antitrypsin deficiency on USMLE, they're going to give you a patient in the 30s or 40s with emphysema. They'll tell you a sibling has had emphysema. They might say one of the parents, because it's a codominant mutation, double Z allele. They'll say one of the parents had cirrhosis. Okay, so it's early onset / accelerated cirrhosis and emphysema. Patients can drink and smoke, but it's a very small amount that will cause disease. Okay, so they might get emphysema after smoking for only 5 years instead of 40 years. They might get alcoholic cirrhosis just drinking a little bit. Wrong fucking answer. Choice C, edentulism is wrong. So this is a fancy word that just means loss of teeth. And this can be seen in patients who have pulmonary abscess. They would show you an air fluid level on a chest x-ray or CT scan, where half of the circle appears white, which is pus settling due to gravity, and then the top half of the circle is black, which is air fluid level. So we talk about pulmonary abscess, aspiration risk of oropharyngeal normal flora. Okay, Bacteroides is a big cause, gram-negative rods. Also Peptostreptococcus immobiluncus. But missing teeth, broken teeth, they can mention. Hypodontia is a different term for missing teeth, but that's congenital. Edentulism is acquired. Also, dysphagia, such as due to stroke history, can cause aspiration, epilepsy, loss of the gag reflex with dementia, Alzheimer, Parkinson disease, alcoholism, okay, causes of aspiration. Wrong fucking answer. Choice is D and E, both wrong. So cestode could refer to, well, cestode means tapeworm. So in terms of lesions that are circular, you may have been thinking of tinea solium, which causes cysticercosis. So that's going to be cyst in muscle pain. It can give you a Swiss cheese appearance of the brain. Neurocysticercosis, not the lungs. Okay, so it's just me being an asshole. Wrong fucking answer. Nematode. So nematodes are your roundworms, and we talk about lung pathology. It could be something like the hookworms, Ankylostoma duodenale, Necator americanus, as well as Strongyloides, not a hookworm, but those three enter through the feet, and they make their way through the blood to the lungs, and then you have the larvae hatch, and they ascend the trachea, and then are swallowed into the GI tract. Very obscure mechanism, but that could in theory relate to the nematodes and the CT scan of the lung here, in theory. Wrong fucking answer.